If, after careful observation and testing of attitudes, fluency, and related speech and language behaviors, you decide that a child needs therapy, what do you do? Where do you start? Obviously, we can't show you everything you'll need to do in therapy, but we can show you some of the fundamental aspects. Let's hear from Dr. Gregory.
There are many individual differences among school-age children who stutter in the consistency of their stuttering and their awareness of difficulty.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
Some of these children may also have articulation and language problems. And as discussed earlier in this video, clinicians should give consideration to these children's feelings and beliefs about talking. As you work to modify those factors that interfere with the forward flow of speech, you choose procedures ranging along a continuum from general speech change, such as pausing and phrasing, easier initiations and smooth movement, to more specific modifications of stuttering. Let's listen to what Dr. Zabrowski has to say.
Therapy should be tailored to meet the needs and abilities of each individual child. In particular, in the beginning stages of therapy, we pay attention to the child's level of awareness and sensitivity. It is important for us to continually check in with the child along the way to assure a good fit between where the child is and where we are in therapy. Therapy for stuttering consists of 3 different but interrelated parts. First, exploring and identifying speech and stuttering. Second, changing or modifying speech and stuttering. And third, transferring or generalizing these changes to everyday speaking situations.
For families living with ADHD or autism, preventing meltdowns is everything. Goalie reduces stress by enabling kids to complete routines independently. Goalie, reinventing routines.
Identification and exploration are logical places to begin therapy with this age group. It's always a good idea for the clinician to model stuttering before focusing on the child's speech. This procedure is conducted in a supportive, positive, non-critical, and non-mocking manner. Now watch as Christy and I explore stuttering in my speech. It's in a funny place. Very good. What word?
Funny.
Good. And can you show me what I did there?
Funny.
Ah. Did I hold on to that sound too long or say it too many times?
Hold on to it too long.
Yeah, and here's another good example of a touch that's not light. Because when I said funny, I did this.
Funny.
Yeah. So I took these teeth here, right? And I...
Funny.
Did I push it?
Mm-hmm.
Yeah.
Funny.
Excellent.
Is that good?
Cold.
Cold out a little.
Did I catch you? Yeah. What did you do there?
Little.
Yeah. So you held on to that sound for too long. Notice how Christy described the physical tension and pushing associated with her stuttering. In this early stage of therapy, she and I merely described what she was doing, with no real attempt made to change her speech.
Another way to get started is to have the child recognize smooth versus bumpy speech. In doing this, he will be more comfortable if he first sees that the clinician is able and willing to produce stuttering himself. Let's watch as Justin recognizes smooth versus bumpy in my speech.
Justin, here's what we're going to do. We just talked about speech helpers.
Uh-huh.
Now what I would like you to do is when I tell you, I want you to pick up one card at a time, show it to me, and I'm going to tell you what the picture is.
Okay.
Sometimes I'm going to use some bumpy speech, and sometimes I'm going to use some smooth speech.
Okay.
But you need to tell me if I do bumpy or smooth.
Okay.
Okay, ready?
Mm-hmm.
Show me the first picture. Oranges.
Smooth.
You've got it. Good. Okay, show me the next one.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
Alligator.
Bumpy.
Why was it bumpy? You're right.
You're like, alligator.
Yeah, I was kind of pushing with what?
Your voice box.
My voice box a little bit. Alligator. Okay, that was a little bumpy, wasn't it? Okay.
Now watch as Justin appears to comfortably recognize smooth versus bumpy in his own speech.
Justin, this is an elephant.
Elephant.
Good. That was using your speech helpers in a smooth way, wasn't it? Okay, now can you say them for me in a bumpy way? Make
Okay.
your speech helpers push hard?
Elephant.
All right, right. What were your speech helpers doing there?
They were pushing too hard.
They were pushing too hard, right. Good boy, all right.
When you are focusing on a child stuttering, you can model it for him. This helps him learn more about the characteristics of his own stuttering. Again, this is always done in a caring, supportive manner. You can then reverse the situation and identify his stuttering as he talks, perhaps using the analogy of a tight fist, as shown here by Dr. Qatar working with David.
Okay, David, what we're going to do today is we'll both get stuck at different times on words, and when I get stuck, squeeze your fist real hard, and then when you're ready, loosen it up, and I'll loosen that word up. Okay? Here we go. One of the things I like about skiing is moguls. I really like it when I go down
I do
moguls. If there's a lot of snow, but if it's I see. I often slip and fall on my behind. Tell me some more about skiing, and I will wait and try and get stuck on a word. See if you do.
Well, and
Good, good. Okay, good. Keep that going. You can do your fist too. Keep it going. Keep it going. Now feel where it's tight. I bet it's tight right in there. Keep it tight.
so
All right. Good.
there's a trail called
Good, good. Beautiful, beautiful, beautiful. Okay, now let it go slowly.
National.
All right. Oh.
There's Fosse. That's
Good. Okay, now do your fist too. Okay, now when you're ready, keep the words coming up. When you're ready, loosen that up.
Snow.
All right. What I was just doing with David was bridging identification with the next step of therapy, modification.